This podcast is for plastic surgeons and dermatologists from all over the world who wish to come into this new world of hair restoration. In this podcast, we're going to see marketing trends, we're going to see how you can set up your clinic, we're going to see all the training that you're going to receive here in ISHR. Also, we're going to talk about innovations, we're going to talk about the future of hair restoration, and everything you need, profitability, your return of investment, everything you need to come here to ISHR to get trained and to get into the world of hair restoration.
Yes, we are the handholders, your mentors. If you want to enter this field, a very fast growing, multi-billion dollar industry, to push the quackery, the plastics and dermats have to come forward, learn the surgery so that nobody goes to Turkey and other small places. You give it to your patients in your place, but you have to come forward, learn it. Let me tell you, huge profitability in the Western world starts anywhere from 50,000 to 200,000 per month to make in hair restoration. In the non-Western world, anywhere around 5,000 to $20,000 per month. So it's highly lucrative. That I'm luring you so that you get excited and explore this field. So don't miss this video. We're going to discuss everything about the plastic and dermats who want to come into this field.
I'm sitting right now with Dr. Vivek, who is the co-founder of ISHR and who is affiliated World Society of Hair Restoration and Surgery. I'm glad to be here, Doctor, with you. How are you this day?
I'm fine. I'm so glad to meet my ex-alumni who was with us at Mumbai for the training. So yes, doctor, throw me the questions.
Yes, correct. I'm a fellow from ISHR. I was trained here, and we're gonna continue with the first question, Dr. Vivek. So our first question, Dr. Vivek, comes from our plastic surgeons and dermatologists, and they're asking, what specific training do you recommend for physicians to address the unique hair restoration needs across different cultures and ethnicities?
Yeah, very good question, doctor. See, basically, it's a microsurgery. It is about magnification and hand-eye coordination. So hand-eye coordination under magnification. So definitely, if you're an ophthalmologist or if you're a plastic surgeon, you do microsurgery, so you have good experience. But what about dermatologists and others? So what we do is first we give them a kit, or we design a program for them to practice at their homes. So we ask them to wear magnification, where to buy them, what is a scalp dummy. So wearing magnification, they start practicing with hand-eye coordination at their own homes in dummy. So if they're busy, everybody is having jobs, they practice and all. So right immediately they should start practicing on dummy wearing magnification at home, number one. Then definitely the surgery requires hands-on exposure. You just cannot learn through YouTube and theory and all. You have to really touch the grafts, and it's a micro precision surgery. So you have to find out places where they can give you great number of hands-on surgeries, great mentorship, the tricks of how to extract. There are 3-4 things in hair transplant. One is hair graft extraction. So basically there is a micromotor marathon punch which has to align with the exit angle of the hair follicles. So your hitting ability should be perfect. Your hand should not shake. You should have great eyesight. So you have to learn hair extraction. Then you have to learn making slits in the recipient area, the perfect slit at perfect angles and directions, perfect depth with the right sapphire blades, etc. So you got to learn that, because the slits could be 10 to 15 degree here, the slits could be 5 degree here, the slits could be 20 degree here and 25 degree, or they could be having a whirl pattern at the crown. So you have to learn slitting. Not that difficult. Touch wood. Great news is that previously hair transplant was done with double forceps. So your left hand should also be good like right hand. It used to take at least 2 years to learn the implantation in a perfect way. But now with keep implanters, okay, or half implanters, anybody can be perfect in implantation within 6 months. Okay, so this has made now, that's why you're seeing growing popularity of various doctors trying to learn hair transplant, because the double forceps has got an option now to make hair transplant training easier. So there are 3 aspects: slit making, graft extraction, and implantation. There are 3 surgical skills. Basically, for that you need mentorship, that you need hands-on training under supervision. So there are only few places in the world who offer great number of hands-on. So you have to unfortunately go there. Or at ISHR, we also have a possibility calling our flying hair transplant trainers to your city, to your own clinic, to your center, keeping your model patients because you are licensed in your country to practice. So we will be guiding you and you are licensed to practice there. Or you will have to fly to Mumbai or Mexico or our different branches worldwide where, legally it is permissible to touch the patients and do the hands-on. But before that, practice on dummy is a very great idea. So it's a microsurgery, hand-eye coordination, under magnification. So hands-on is very critical. You have to find a way where you can practice at least 20, 30 patients, at least 10, 20 patients under supervision. And then you do small cases at your clinic, 300, 500 grafts. So as you keep doing cases, your speed and expertise increases. That's it. Yeah.
So, doctor, since this is a worldwide uh, association, you're going to have different type of races. You're going to have black people, American African people. You're going to have Asian people and different type of races, which will have a hair follicle that maybe is different.
Yes.
Maybe you want to tell us a little bit about this.
They're perfect. See, the most toughest case is the black because their hair follicles are C-shaped. So imagine if you're trying to extract them, there's a high chances of transaction. So they need some different machines, they need some different bunches, and they have to do slowly. So a black doctor who has predominantly patients who are black, definitely needs exposure on some black cases. Touchwood, we offer all our doctors who want to come to us. If you have any patient who is black, then you want exposure on black, we'll do free hair transplant. Get your known people or anybody who is black who need a transplant. It's a free hair transplant during your training program to give you the exposure. So we have given an incentive to bring the black patients to us because see, not everywhere black patients are there. Maybe in Mexico you still have, India it's less, right? Maybe in Europe, our branch, in the Greece, there may be few. Of course, the branch in South Africa or Nigeria, we have no shortage. So sometimes for black patient exposure, we might send you to specific training centers or you get the patient, number one. Caucasian with blonde hairs are a little different from the rest, the Asians, but not too different. Maybe the diameter of the Asians is more, the length of the Caucasian hair is less, but predominantly not much of a difference. Even if you have practiced on an Asian patient, virtually no much problem practicing doing a case of Caucasians. If you practice on a Caucasian patient under supervision, if you have extracted the hair, doing an Asian should not be a problem. The real problem comes with a black patient only. Okay, and of course you need to get exposure to female patients, transgender, the beard hair transplant, the eyebrow hair transplant, the temple hair transplant, the body to scalp hair transplant. So the curly hair and the black is the toughest. Rest all, even if different ethnicity, should not matter much. Should not matter much. It's only black patient required.
Great, wonderful. So, doctor, tell us a little bit how it is for someone, for a physician, to be a student in ISHR. What is your staff? How do you provide training? What is it one day or two within ISHR?
Yeah. Taking into a journey of once you come to any of our ISHR headquartered Mumbai or the Mexico is taken care by Dr. Ruben or any other branches in Europe, Africa and all. So it starts with first, you deposit a small amount and you enroll with us. You send your legal certifications of registration, etc. So you're a licensed doctor, legal to practice a restoration in your country. So we need those documentations and your identity proof. Then we are going to give you the address and a lot of options to book hotels of different range, 2, 3, 4, 5 stars or Airbnb options to stay. Mostly one of our cab and the driver goes and picks you from the airport to your hotel. Now before even you come here, we start sending you study material on the WhatsApp. So once you've decided, there's no need of wasting time. Immediately you should start studying some digital books, some study material, get accustomed to the field of hair restoration. Then we have online lectures. where we discuss. See, our training is not one person speaking and other is listening. It's an interactive. See, most of them are plastic dermat already well learned it. So it's not something too difficult for them to learn. So we believe you should think that you are an empty paper, absolutely new to the subject. The more questions you ask, the better you will get out of here. Okay? Question everything. Logic behind everything. Science behind everything. What we say or what books say is not so important. But every damn step what we say. For example, if I say your slits at the frontal scalp should be 20 approximately degree, 20, 25. You should ask why not 90? Why not 45? Okay. If I say not to use adrenaline over here, which normally people use for bleeding, then the question should be why so? If I use, what happens? If I don't use, what happens? If I say simultaneously extraction of hair follicles from back of the scalp to the front, then you should say what if I keep it 3 4 outside? What changes that happen? So what we promote is, we love is, we promote questioning of the students, letting them understand, get the logic behind every step. Because after they go from us, they themselves will become great surgeons in 2 3 years. But hair transplant is a developing field. So once they understand the logics and everything behind it, then they can read scientific articles, attend conferences, do their own research. Then they tend to become some great surgeons. Otherwise, we just follow what is written in the books won't work. So coming back to your question. So once this online theory lectures are done, as well as promote practicing on dummy scalp, which is Coriate from Mumbai, or we ask you to buy from Amazon, you start practicing. Now, when you come here, we have surgeries every day. We have consenting patients, model patients, or permissions done. They're under supervision. First, you will practice on the dummy, and then you will be extracting some hair follicles, making slits, and implanting. So you will start with 25 30 extractions, 25 30 slits, and 25 to 30 keep implanters. After 4 5 days, you will move on to 50. Then you will move on to 75 grams. Then you will move on to 100, 150. So by in 3 months' time, you should be able to do with us at least 1,000 grams. Okay, and in 6 months' time, you should be able to do us with us 2,000 grams. In 1 month's time, maybe one or two cases you can do 300 to 500 grams. Otherwise, normally around 200 grams you should be able to do. Now, whatever exposure we give will take you to X level. The speed will still be slow. That's why we say and we remind them, do not forget us. It's not doing a fellowship and forgetting. Please find your patients, maybe free patients, and start doing on central part. At least one or two cases you go back and do at your own clinic, the confidence level is different. And remember, this is a teamwork. You need nurses to help you. You need. So touchwood, we provide a very highly skilled senior technicians across the globe, licensed one, because they would have experience of 5 7 10 years they are doing daily. So once they are with you, your implantation process is faster. So you can finish more grafts. So even if the top plastic surgeons, dermatologists is there, they will need a senior technician. Let me tell you the secret. All the doctors across the world, all the top plastic or dermats in this field, they cannot afford to lose their senior most technicians because they have been trained, they have been taught. That makes their life easier. Technically, doctor is supposed to give the local anesthesia, make the slits by the doctor, punching by the doctor. Technicians are allowed to take out the grafts, manage the OT, manage the trolley, and implant the grafts. And there are different methods of implantation like keep implanter, double forceps, DHI implantations, different. So yes, you will get great hands-on exposure here. You will watch consultations. You will watch hairline design, and you're going to design the hairline through laser hair, through stencils, different types, long face, round face, triangle face, different ethnicities. Normally, we have a lot of patients, Caucasians also, Middle Eastern also, who come to our centers as a medical tourism to do the transplants. Okay, so the hairline design, what is science of anthropometry, what is golden ratio, what makes a men or women more attractive, left right balance, this all balances. So all these things will be beard to scalp transplant, body, the power of temples have to be implanted flat, the curl has to go here, not here, soft hair has to be put. So a lot of detailing. Then you learn PRP, which is quite old now. You learn the real thing called IPRF. Then you learn GFC. Then even GFC is old now. You learn how to take out your blood and prepare autologous exosomes, which is 2 trillion plus growth factors in it. You learn what is boosters of FUE, that is ATP, DMEM, exosomes, and much, much more. You learn how to prepare a patient for a hair transplant. Minoxidil, finasteride, vitamin D3, vitamin B12. Prepare this because there's fire here with the DHT. A lot of people forget that. So quite detailing, right from preparing a patient 2 3 months before to follow up of the patient. Great hair transplant will happen when you look with excellence and passion into small, small steps. To brief you, patients should be put on minoxidil, finasteride, and vitamins so that this become fertile. The fire of DHT is taken care of. The stem cells which become dormant due to the stress can be taken care of. So you give best possible possibility of the new grafts to grow. Okay, antioxidants the role. Then comes is how to reduce the bleeding. We have a new protocol. We learned through cardiac surgeons what is tranexamic acid, what is vitamin K, what is botaprase. So we don't have to stop minoxidil, which majority of the people stop, and still we don't have much of bleed. So if you stop minoxidil 15 days back, bleeding will be less. But what about telogen effluent? Okay, so plus you have to filter out certain patients: epilepsy, cardiac, severe diabetes, bronchial asthma, allergies, keloids, varicose veins. You have to filter out. Okay, as a new practitioners, don't do that. Do healthy cases. Fully equipped OT like a mini ICU. You should know how to handle emergencies. You might have an anesthetist with you. So once you come to a proper institute, there should not be any chance of safety lapse. And every small detailing, it's a journey of a hair follicle from back of the scalp to the front. So every detailing, no crushing of the follicle. Don't hold the follicle at the stem cells level. Don't let them dry. They should be at the perfect depth. If they are like this, they go too deep, and deep dermal plexus is damaged hematoma, and they may not survive. That's why they have to be 30 degree, okay, so that they don't cross the deep dermal plexus. The instrumentation should be very fine because when you slit, there's a primary ischemia and reperfusion. When you put the graft, there is secondary ischemia. Okay, although scalp is highly vascularized, but still needs for the graft. Avoid necrosis, lesser growth, no putting any double follicles, no straight line, macro irregularities, soft hair from nape of the neck in the front. So if you look at it, it will going to be a long podcast. It has to be very, very detailed because today the competition is very high. So people are not just interested in getting some hair. Now they want the dense hair, natural hair. Then donor management, not donor depletion, not damaging the existing grafts while you're taking out the graft from the donor. What about this donor? What about post-FU marks? What of the body donor? So hair transplant is really evolving. That's why the demand is there. One way is there's a baldness epidemic. On the other side, demand is there. Now the world requires highly trained and skilled people. So automatically the quackery will go away once the qualified people start learning. So that's why inviting all the plastics and dermats, read, study, learn, become entrepreneur, become leader. If you don't do it, somebody other qualified will do it. Then don't repent. You learn. Then the patients get the best, and the world becomes a better place.
Yes,
Yeah,
of
yeah.
course. And Dr. Vivek from ISHR, with this detailed explanation, uh, what is it or what do you require in setting up your clinic? How does ISHR help you setting up your clinic?
Great. See, touch wood, it is very, very low cost to set up a clinic. The most important is your minor operation theater, which in a developed world could be set up in $10,000. In developing world, it could be set up in $5,000. So it's not expensive to set up a minor OT. Or if you're already a surgeon or dermatologist, you might be already having a minor OT. So all you need is a hair transplant instruments. So hair transplant instruments, all types, normally come around $1,000. So practically speaking, if you have a minor OT, if you have a setup, all you need in a bag is $1,000 hair transplant instruments. So it is the skill. The instrumentation is not expensive here. So how does it, what do you need? If you already have a clinic, great. Of course, you need a clinic, maybe a 1,000 square foot clinic. So, of course, a clinic need a reception, the board outside, a light location, a neat, clean place, a reception for patient to sit, bathrooms for the patients and the staff, a consulting room, a place for cafeteria for people to have food, a small place for your administrative staff to sit, then a small place where you can do hair loss treatments like PRP, PRF, GFC, lasers, etc., etc., and a minor operation theater where you're going to do the hair transplant surgery. So 1,000 square feet is good enough. Of course, you can have 2 and 3 and 5,000 as your case increases, but minimum 1,000 square feet, right location where competition should be low, okay, and where 20 to your patients are going to be 20 to 40-year-old male mostly. So these are IT guys, finance guys, So find out that place, a growing part of your city where not new, old doctors are not present. Some part of the city is developing with new high-rise buildings, new corporates opening. So wherever you find these 20, 40-year-old people employed, so that is the place you should do. Number two is, so ISHR helps right from discussing with you regarding your city, what is the potential of your city for hair restoration? What are the charges of hair transplant in your city? What is the competition in that city? How many number of cases can you expect? What sort of profitability are we talking about? Then we help you. We have a team to guide you for the right locations to choose. Then we also have interior designers to guide you what should be a brand, logo, look, feel, color. Okay, is it blue and white, purple and white, black and white, total white, ivory white, whatever colors you have. So we help you create your logos, your brands, your communications. Because it's not just knowing the surgery. You may be the best surgeon, but people don't know you. The other person may be inferior surgeon, less competent surgeon, but he is letting the world think that he's the best. So why? So whatever you don't know in the medical college till now doesn't matter. Either you learn, it's easy, or you take our support as a mentor. So hold our hand. So we have a team to set up your website, Facebook, Instagram, TikTok, YouTube, X, Twitter, etc. So all you need is a great photographs of yours doing surgeries in proper OT dress, your team, your infrastructure, your achievements, your qualifications, your awards, okay, what great work you have done. So we put it all across our team puts this all across the digital media, the videos, what we are shooting now. See, if we were not talking and shooting this video, this information won't reach the people. So don't feel shy. Even if you can't speak, if you're an introvert, don't feel shy. Just try. You don't require anything. You have to just put a phone, put up a light or illuminated place, and you can speak on the subject. So you have to make videos. We make some videos for you. Videos like what would be the cost of hair transplant in my city, then what is hair transplant all about, what are different techniques, what are the new advances in the field of hair restoration, how many days holidays you have to take, what are the complications, who are fit for surgery and who are not fit for surgery, okay, how is your technique better than the other techniques, okay, what sort of experience you have. You have to showcase your before after pictures, your videos. So we help you in everything. See, we can help everybody. Now you have to come forward, because once this batch goes, next batch comes, then this batch goes, next batch comes. So we have seen those who be in touch with us, they are surely successful. Some people, because of some personal issues, some hectic issues, they are not able to follow. So ISHR helps in setting up your center, so that you succeed. Brand position your center. We have a special division called Hair Cinema. Okay, even if you want an investor, we have investors worldwide. If you want an investor, like if any of your students want to invest in Mexico, we advertise there, even try to help you how to get an investor. So don't worry, we are your total mentors. We know you are young doctors. You are recently coming out of medical colleges. You have no idea of this world. We are already crossed all this, phases of life. So I'm 50 plus. I won't tell his age because
Don't
he's a
worry, you
young
can.
guy.
You can.
He's a young
I'm
guy.
almost 52.
Yeah. So we have gone through, you young doctors coming out of the college, life sometimes feels very tough unless you're very privileged, having very rich parents, because you have taken loans for your medical education. So we understand you. So we are supposed to be your mentors. You want investments, we help you. You want to set up a clinic, we help you. You don't worry. Limited amount, you can set up a clinic. Of course, if you have good money, you can set up that better. The most important is acquire that skill. And we give you technicians. Now, if you have, not everybody can come to us for 6 months, 1 year, 3 months, 1 month. Some people can come only for 3 days, 7 days, 15 days. Then what? They cannot become super expert. But definitely, being with us, they will know how does a hair transplant center runs. Follow-ups happen, head wash happens, PRP, GFC, exosomes happen, hairline designs, consultation. So once in Portuguese, in Colombia, in South Africa, in Nigeria, in Beijing, in Kathmandu, in Kuala Lumpur, in Jakarta, in Sydney, in Melbourne, in Montreal, in Toronto, in UK, in Brussels. So we have East European technicians, technicians in Australia, technicians all across America, technician in Gulf, technician in India, Iran, technicians all over. So we help you get them into your country. So once they are with you, then your journey kickstarts very fast because they have the speed. And two, three. Otherwise, you can send your nurses to us, your assistants to us. So we train them the implantation part and how to assist you in the hair transplantation. You will require at least 50 to 100 surgeries, supervision with us to be able to do well. But you have to start somewhere. Can you imagine what sort of money are we talking? See, in the Western world, in America, $10,000 plus is one transplant. So, see, on an average, a postgraduate doctor, I'm not talking about dermatologist, an average postgraduate doctors get 30,000 US dollar after taxation, maybe 20,000, or get 20,000 US dollar after taxation, $16,000. Imagine you are doing $10,000 transplant. You do 5 transplants, it's $50,000. Your expenditure is not more than $10,000. Okay, so 80% profitability. If somebody pays you $10,000, you are making 8,000 profit after taking off the technician fee, the medicine fee, the advertising fee. Even if you don't have a facility, no problem. You can hire a facility. You can pay for a facility, but it is advisable to have your own facility if the cost of paying is high. So in America, $10,000 plus. In Mexico, $3,000 to $4,000 hair transplant. In India, $1,000 to $3,000 hair transplant. In South Africa, $2,000 to $4,000 for hair transplant. 4,000 grafts I'm talking about. In Canada, 8 to 10,000. In Australia, in US dollars, at least 5 to 7,000. So still, only few countries are saturated. India is saturated, Turkey is saturated, Korea is saturated, Nepal is saturated. Only few countries, my dear friend. Rest is all are raw and empty. So we have seen when there was no competition in India, we used to do 15 surgeries a day. Now with competition too much, everybody learning it, now we are able to do only 2 surgeries a day or 1 surgery a day. The cost has also dropped. So same thing will happen in your country. Don't delay. The leaders start fast. Dr. Ruben is going to have chain of clinics, hair transplant across Mexico. He might even enter America. So be aware the American doctors, right? So,
Of course,
yeah.
of course.
So he is a good technical and business doctor. So if you delay, so because see, anybody who comes to us is a leader. Nobody can fly away from the country and come to another country. Nobody can take leave from his regular job and come to us. Nobody can stop his private practice and come to us. It's take courage. It take leadership quality to even come to us. So the moment you've come to us or any such center, you're already a leader. All you need is some funds and continuity for 1 year. This 1 year you give to this subject. Let me tell you, see, even if you do angioplasty, cardiac surgery, knee replacement, at least I'm talking about India, you're not paid as much, unfortunately, as a hair transplant doctor is paid. Okay? And you are not supposed to do everything yourself. You're supposed to make slits and punch. The rest can be delegated to the technicians. Where you pierce the skin, local anesthesia, it's your baby. So it's not like 7 hour surgery you have to do. 2-3 hours of yours are sufficient. You can hire junior doctors also. So different countries have different legality. Like in India, plastic surgeon and dermatologists can do. Maybe in UK, even a graduate doctors can do. In Australia, Indonesia, graduate doctors can do. Canada also. So different. There are aesthetic GPs also. So we find out which country who is legally allowed. Only those doctors we train. So that's why we want your certification, your license requirement. We check in your country, are you licensed? Or you have to do under a licensed doctor. Okay, and we do train technicians also because there's a huge scope for technicians all over the world, and every doctor will need a technician. So we train them, and they will have much paying earning capacity rather than just being a nurse or OT technician. Okay, so ISHR helps you starting to finish. Even after you go from here, you start doing your cases, you send your photographs of your patients, medical reports of your patients. The whole technical faculty, including anesthetist, is with you on the WhatsApp. If you have any problem with any patient, be in touch with us. Do first 10-20 cases under our faculty supervision. You don't think that you know everything. Do under supervision. Okay? Because whatever results you give, that's what people are going to know. If you give some bad results and your reputation spoiled. So be very careful about first 20 patients. It should be done under our supervision of our faculty. Yeah?
Yeah, definitely. I mean, we can see here that ISHR is definitely a global medical association that specializes in hair transplant. And as a global association, Dr. Vivek, I want you to let our auditorium know, as I already know because I'm a fellow of ISHR, but I want you to tell our audience what or how your marketing team develops
Mhm.
all a marketing strategy specifically
Mhm.
for the country where you're coming from.
Mhm.
And you know, this has to do with different ideas or cultural differences that may arise from being from different countries. So you have quite a team set up here for marketing, and they develop all these strategies specifically for these doctors that are coming from the United States, from Mexico, from Russia, from South Africa, from Europe, from all the continents. That's very important for us. How ISHR supports us through all this trip.
Great. I will take two parts into this. Let me talk about the ISHR, the hair transplant training part. See, first and foremost, we are also interested with our ex-students, alumni who are doing well. So we are also looking for plastic surgeons, dermatologists, or other doctors who have a good facility, who are licensed to do hair transplant in the country. So we want in major countries of the world, ISHR, like World Society of Hair Restoration Surgery, ISHR is one part. So we having Mexican Hair Restoration Society, local associated with WSHR, the separate American Society, European Society, UK Society, different societies. These are new societies. They are not the other societies which exist. So we are making them part of World Society of Hair Restoration. South African. So there are old societies. No, this is fresh societies of fresh doctors with newer vision who are aligned to us. Since it's a private organization. So major countries, we are choosing the right doctors, and through this video, we're inviting. If you are a hair transplant surgeon, if you have a good place, good infrastructure, doing good work, then please WhatsApp us and show your interest to partner with us. We want to partner with leading hair transplant surgeons and centers across the world, exclusive, one-on-one in one country, so that we work under the World Society of Hair Restoration with multiple associations to support it. So that we have conferences, we have webinars, we have both technical discussions of these society members, as well as we have marketing and business development of the society members. Because we want to be the forefront of hair research, we have created a hair follicle lab in Germany. We have put allogenic hair on my own hand. So we have a research division. We want multi-central trials. We want to present scientific papers with multi-center studies. So we have a responsibility to really grow this field of hair loss, hair growth, hair transplantation. So that's why I'm inviting all the talented people who are scientifically oriented and who also knows how to do the business. Okay, so we make local country society. We already have so many country societies aligned with WSHRS. If your country is missing, contact us. And if you like, we like your work and you qualify for the same, then you will be offering ISHR hair transplant training in your center for your country, so that you have your ethnicity patients also, and your doctors need not travel all the way to few centers which we have. So for that marketing, we believe once we have this chain of countries under WSHR as the World Society, that's too powerful, both technically and business wise. Because if we maintain the high standards of choosing the right people, then this becomes centers of excellence for training. Okay, and that's our passion. Training, academics, passing on the knowledge, developing new techniques. See, being a doctor, money automatically flows. Nobody wants too much greedy. It is sufficient enough to take care of a life. Okay, but that excitement of finding new things like growing a hair follicle in a lab, allogenic hair transplant implanting, improving hair restoration procedures, use of molecular dermatology, stem dermatology, okay, epigenetics, that excites. Use of AI and quantum to improve human health, that really excites, because we are all have limited time on planet Earth.
Right.
So we need not be so greedy. But creation is what nature wants. Nature wants evolution. Nature wants expansion. Nature wants creation. So it's the creation which drives us, not just money alone. Now, coming back to your first question about marketing for different countries. For example, Dr. Ruben, how we are helping him. So Dr. Ruben in Mexico, so Spanish is also speaking there. Okay. So we will be having more podcast where he will be translating all my English into the Spanish. Okay. So we are in discussion. We take a case study of Mexico, that how many centers are there? What is the pricing there? Or is it the same 20, 40-year old who's losing hair? Okay. Then we create, see, like there should be a hair loss division also, because not everybody needs a hair transplant before they lose hair. Women mostly are going to be hair loss only. He has also been trained on scalp micropigmentation. So, that division is there. He has his own range of hair pharmacy. He has his own range of products. Okay. Then he will also be training doctors in his institute in alliance with that at Mexico. So there is multiple stream of earning. One is the training of doctors and technicians. One is his hair loss products. One is his hair loss clinic. One is scalp micropigmentation, and of course hair transplants. Okay, we keep now, for example, in India, software systems are low cost, AI is low cost, manpower is low cost. So all his marketing thing will also be back end at India, and he will have a front end in Mexico to customize. So basically, what you require is a proper software and a systems. Okay, wherein a patient calls you, and the time the patient completed surgery, everything should be proper documented, which we provide you. Okay, so once you have a systems built up, software and systems, so everything is digital. We don't have to speak much. Number one, that's called foundation of the building. Number two, we have to hire the right people. So for marketing your clinic, hair transplant clinic in Mexico, what we need is number one, this is the time of social media.
Yeah.
We have stopped writing by pen. Tomorrow we won't even type. We want to speak, and the AI is going to convert us into text. So unfortunately today, what is seen, because there's too much rush in the, everybody just scrolling on the phone. So you need to have a small unit like this with a chroma, lights, camera, and you have to make multiple videos detailing about what do you offer to your patients and educating your patients for the field of hair loss and hair transplant. It's very, very important. If some doctor is good in communication, great, they should speak. If not, they can have some other family member or other staff member to speak about it. Okay. So this is one. You need to have a video editor and a graphic designer with you, because you don't have time. So he will edit the whole things. He will do the research of the topic. Okay. And he will design everything. So if you have one employed, great. Otherwise, countries like India, China and others, especially India because English speaking country. So you can always have backup facilities. Whatever you shoot. See, we have a hair cinema division. You can shoot anything on your phone and send it to a division. They will understand your requirement and customize, edit and give it back to you at a nominal cost. Only for our students. It's not available for outsiders. It's just to help our students. So this video production is a very critical part, whether you are selling plastic surgery or dermatology, cosmetic dermatology or hair transplant. This is very, very important. Okay. Then if you do scientific paper publication, it really helps in your community. So you should be pioneering, present newer options, do proper documentation, and in different conferences, books, articles, the more and more scientific publications you do, the more and more community doctors know you. So a lot of time patients ask the fellow doctors to recommend. So if among doctors community you're well known, automatically your recommendations are high. Then your receptionist, your telecallers, okay, now they are AI agents. You have to learn AI. You have to do a lot of AI courses. So all you need is a great receptionist and a great telecaller. So once your videos are on, see, you have to stand for one single thing. Like anagen hair transplant, it's a regenerative FUE differentiation. Okay, premium hairlines, dense hair transplants. Okay, so you have to start. You have to be one step ahead of your competition in research and development, and you have to showcase great results. So you should have a photography room where the camera, the patient, the lights, consent of the patient, great photography showing the hairline, video, everything with good lightings. Okay, if you can document your patient's results, Like if you go to Hassan and Wong right now, go to his website, go to before and after section. Beautifully, sir has, he's quite elderly and quite senior, but he does lovely photography. Okay, so just go and see his website. So that sort of photography is required. If you do that, if you have telecaller, one videographer and editor, is more than sufficient. Okay, remember, delegate your work. Don't be miser. You have to study, you have to read, you have to attend to the patient, you have to do surgery, you have to follow up the patient. Most of the doctors, unfortunately, have to do social media marketing now because they are not ready to spend or find and delegate the work. You have to spend some money, get the video editor, graphic designer, get a telecaller, get a good receptionist for follow-up of the patient. So whatever money you're spending on them, you want to make through your practice. So resist this temptation of not employing good quality staff, it's very important. And you have to attend the YouTube, everything is free now. So we also mentor you on how to brand, position, design your clinic. We cannot make you expert overnight, but we do help you. Okay.
So, as we can see, Dr. Vivek, mentorship is one of the most important details that ISHR offers here in Mumbai, India. And two things that you mentioned right now is not alopecias are qualified for hair transplantation. And this being said, uh, you not only teach hair transplantation, but also which scalp conditions cannot be hair transplanted, but also what are the complications that can arise from each procedure. Tell us a little bit more about that.
Very important. See, I should not say, but I have to tell and warn everybody. Just 2 months back, a black man from London in a very good clinic in Turkey expired. So even in Spain, somebody expired. So in hair transplant surgeries, unfortunately, it's a 7 hours local anesthesia procedure for 2 days. Unfortunately, people are still using preservative local anesthesia, like lidocaine adrenaline with preservative methylparaben, bupivacaine with preservatives. So these preservatives can cause hypersensitivity and even death. Okay, so we have to filter out certain patients. So once you do a proper training, you have to do whole analysis. Like from here, epilepsy, be careful, cardiacs, diabetics uncontrolled, bronchoasthma, varicocele, and varicose veins most importantly. So we train them to analyze the patient. If it's a risky, it should be in a hospital setup. If it's a little risky, anesthetic should be there. Proper investigation should be there. See, it's a planned procedure. It's a cosmetic. So it's not a heart surgery or a liver surgery. Okay. So we should not be greedy. We should say no to certain patients or tell them the risk involved. Why should we be in a problem and the patient be in a problem? He can put a wig, he can do SMP, he can shave it off. So we have to balance risk versus benefit. So certain patients to be avoided. So we also train on what is the best possible safe for local anesthesias. We even do treadmill tests because in India, we are the world capital of diabetes, cardiacs, with the lifestyles. America is becoming obese. Okay, so we have to be very careful to do thorough analysis of cardiac allergies. A lot of people are allergic now. Okay, so if suddenly hypersensitivity occurs, it's an emergency. So we thoroughly train them which are the good candidates and which are the risky candidates. For risky candidate, how do you prepare? How do you have backup support? How do you have a corporate hospital nearby? What sort of things you should have? So our anesthetist also trains them some basics of ECG, epinephrine, hydrocot, AWIL, DEXA, what complications can occur, local anesthesia toxicity management. So normally with preservative-free anesthesia, which we are using, there's no preservative. So even if it goes inside the blood, nothing happens. The lidocaine cardiac. So we have shifted to that. But 99% of the clinics in the world are still using, I'm saying 99% plus clinics in the world are still using lidocaine, bupivacaine with preservative.
Wow.
That's the danger. So with this video, to my fellow colleagues, think about it. Use preservative-free local anesthesia. No methylparaben in lidocaine. No methylparaben in bupivacaine. Safety is done. And then no uncontrolled diabetes, no cardiac issues. Check it out if somebody is 35 plus. These are the few things, and keloid and hypertrophic scars and varicose veins or bronchoasthma. Otherwise, These are young guys, 20 to 40, and they are mostly safe. Of course, too much smoking, drugs. Okay, you have to find out. See, it's after all, it's a human body. We may be dealing with hair, but we are dealing with the human body. So we really emphasize hugely on how to make a safe hair transplant, because in this business, any patient comes, there's a greed with everybody. Let's do it because the dollars is in the hair. More the hair grafts, more the dollars. So sometimes there's a temptation not to leave a patient. So that you have to resist. That's what we teach you.
Yeah.
The ethics and honesty.
Great. This is very, very important because as physicians, we're treating humans,
Yeah.
patients, and we need to be on top of our game.
Yeah.
We need to be very, very prepared, which Dr. Vivek with the ISHR takes very, very good care of the students or all the physicians that come in to get training over here.
You know, the last time you saw the patient 9 from one pathology lab, his HbA1c was 4.9. We had a doubt because fasting was 128.
Yeah.
So we repeated the HbA1c, it came out to be 9.
Yeah.
Think, if we had believed that report and did a surgery, we could have landed emergency. Right? You've seen that.
Yeah.
So sometimes severe autoimmune diseases, okay? So scarring alopecia, you know, somebody is having alopecia areata, LPP, psoriasis, so many scarring alopecia, fundal fibrosing alopecia, especially in the blacks. We didn't diagnose and we do the transplant, we are losing his grafts. You know, the few days back we did a burn surgery, hair transplant burn. So we are not going to do too much on that. We'll do a patch test. Okay. Similarly, you know, we talked about beard hair transplant. One French guy, 24-year-old, he did it from Turkey. Supposedly, who did it, we don't know. You can just type on the Google, French 24-year-old guy committed suicide after doing beard hair transplant because his hair grew like this. Some European doctors also recommended him free surgery for correction. Okay, there are corrective surgeries, repair surgery. But think, a 24-year-old guy went to Turkey. See, you cannot just think about money. Okay, money is important, but places like Turkey and all will vanish if you in your country start learning plastic surgery and dermatologists and plastic surgeons and other legalized doctors. Because if you are not learning, then the places like Turkey is blossoming because they have more number of cases, they offer at low cost. So even if you all have a lot of people in your country learn, there will be competition and the cost will come down because the profit margin is huge. Out of $10,000, you're putting in your pocket $8,000 profit. Out of $5,000, you're putting $3,500 in profit. Multiply by 10 surgeries. Compare with what are you earning now. So, and over there, there are 20 surgeries happening in a day. So why should your patients of your country go to other places only because you didn't have time, you didn't put effort to learn it? Yes, I understand. When we started, nobody was teaching because of competition. Nobody wanted to teach anybody. Okay, but now as we become old, okay, so our major issue is teach. So now opportunities are available to get trained. You have to take that step. Now, one more thing. Because we love to travel, we love to enjoy and have picnics and holidays. So we are 30, 40 doctors across the globe. We have decided that we are going to do 3-day workshops in Singapore, Jakarta, Mexico, Canada, US, Dubai, Cape Town, and so on, Beijing. So if you want, we have 40, 50 top doctors across the globe who offer these workshops as part of WSHRs. So if you want one of the teams to come with the trainers to your city, to your clinic, WhatsApp below with your interest. If you're legal, if you are legally licensed to do transplant, if you have a legalized facility, then you will invite a training facility under their supervision. You're going to learn hair transplant and do a workshop. So you maybe 4-5 doctors come together, have a facility. We will send from our organization trainers to do hair transplant training for you. And of course, we have FISHR, Fellow in Hair Restoration. Okay, and shortly, World Board of Hair Restoration Surgery is coming up, which will be, you have to write practicals and theory exams, and you will get World Board of Hair Restoration and Surgery certification. And we are talking to various medical councils and medical boards worldwide. This will be only to very selected people who fulfill the criteria, so that the different medical councils and medical boards in the world have a standardized examination with global faculty, which is totally transparent, so that medical boards can accept those certification. So it's under process. We'll let you know. And if you're really interested in research and academics, this is the place. We have a scientific FUE committee. Scientific Hair Restoration Committee. We have Hair Research, Biotechnology and Stem Cell Committee. So the best doctors and researchers and molecular biologists and molecular dermatologists are in their team. So they are continuously researching, doing multi-center trials. So we are again inviting academic-oriented doctors. Send your proposal to us. We might put you on the team so that let's work together to make more hairs and better hairs. Okay, had we been to cardiac surgery or cardiologist, we would have loved it. But unfortunately, we landed up in here. So, okay, so hair is not so important, but still, we have to do what we know.
Yeah,
So all the best, doctor. It was nice talking to you, and we see you next year, 2026. We'll be there in Mexico,
of course.
at your center, where we're conducting the big hair restoration workshop.
Of course, we'll be
It's a
there.
pleasure
Thank
hosting you, and be in touch. And ISHR is, as before, always with you, and we would like to have chain of hair transplant clinic in Mexico. So all the best. Wait for the next podcast. See you, doctor.
See you. Thank you.
Thank you.